Joining me now, epidemiologist Nazeem Muhajarine. Thanks for coming back onto the program, Nazeem.
Thank you, Angie.
So
thanks for having me.
What have you been tracking? What have you been looking for here when we're talking about this new variant, this Omicron variant here, and what your concerns are?
So, Angie, it's interesting to really note that, the 5 cases that we have identified in Canada to date have all been travel-related and to a specific country in West Africa, which is Nigeria, the most populous country in the continent of Africa, and quite a ways away from the southern African countries, the 7 countries, for example, that Canada, like restricted traveling from. And so I think this tells me, and it tells everyone, that that Omicron variant is probably circulating in countries outside of the southern African countries that we have been noting this past few days, and it tells us that that we have to look for this particular variant at the borders, not through travel bans necessarily, but through the classic approaches, epidemiological approaches, public health approaches of testing, a comprehensive, careful testing, and tracing contacts if need be, and isolating and quarantining people, who need that, that measure. So I think we had to really be doing a lot more testing and a lot more carefully and comprehensively.
I wanted to ask you, Nazeem, more about that testing and how critical that is now, once again, because it also incorporates all of that contact tracing where we can track things. We know, for example, the PCR test that's required for short trips for Canadians going across to the United States and coming back, that 72-hour period, that requirement has ended today. But would you say then that regardless, though, those PCR tests, wherever in terms of moving around, in terms of that traveling around, should be mandatory?
Angie, I think we have to watch this situation that is developing quite quickly. Today, maybe we don't need to reintroduce the requirement of PCR testing for those people who are, crossing borders, on land. But in few days, we may need to consider that because we do see that Omicron is spreading in the community, and we have not seen any cases detected in the States, which surprises me. And so I think this is a really a very dynamic, very fast-changing situation. I think the precautionary principle would tell me that we probably be needing to look at the PCR testing requirement kind of reintroduce for travelers. Right. It's better to do that than not. Right now, given Omicron.
I've got a few seconds left, Doctor. I want to just get your thoughts here on the vaccines. A lot of people are sort of concerned, questioning, saying, are the vaccines going to be effective against this new variant? Again, there's a lot of information that we don't have. Right. What are your thoughts there? Your advice here? I've got about 20 seconds left.
Yeah, Angie, this is the biggest question. I think we really cannot say much about vaccine efficacy, with the Omicron. What is encouraging to see is that Omicron related deaths and hospitalizations, ICU bed use, is not seen in places like South Africa and Botswana about 20 days after it was initially detected. That gives us a little guarded hope that maybe it is not as serious as perhaps some of the previous variants, but it is a very, very tentative right now.
Yeah, something we have to be keeping a close eye on indeed. Epidemiologist Nazeem Muhajarine, thank you as always, Nazeem, for giving me your time, your analysis on this. Appreciate it.